How's it going, class? My name is Joe Morales. My project is on 2C-B, also referred to commonly as bees. This drug was considered a Schedule 1 drug due to its high potential for abuse. It was discovered by Alexander Shulgin. He explored a lot of psychotherapeutic drugs. He actually synthesized this one himself. He also wrote a book called Pical, where he would journal and essentially categorize drugs based on his own experiences. He actually ended up describing 2CB as a luxury of sensory enhancement and minimum introspective demands. It was used recreationally pretty widely. It was actually marketed at first as kind of a libido enhancer, as well as a sexual arousal enhancer for people with low sex drives or ED. It was also intentionally used for psychotherapy, was its initial intent, and it was seen to have a common effect amongst all patients, which was lowering their guard and essentially having them more susceptible to open up about very sensitive topics within their lives. It gained a lot of popularity in about 2009 with young adults in the rave scene due to its enhancing visuals, and it maximized euphoric events. There was also some African tribes that used it pretty widely. It's referred to as an entheogen. It's just kind of believed to be used for religious use. So they would take it and they would either feel more connected to a higher power or themselves or everything around them, and it would kind of be used almost like ceremonially. They refer to it pretty often as medicine of the singing ancestors. This drug is not to be confused with 2C. 2C does get its name because of it's in the 2C family, the literal number 2 and the letter C. 2CB is a white powder, not a pink powder like 2C is. But 2CB is a white powder which is often compacted into pills, so it can be ingested both orally and nasally. Obviously, when it's inhaled, the effects are much quicker and they do last a lot longer. So when ingested orally, an effective dose is about 10 milligrams, and what's considered an extreme dose is 35 milligrams. The effects orally do last about 8 hours, and the effects are assumed to be felt within an hour of consumption. Nasally, it changes a lot. Nasally, it's felt within 10 minutes, and it can last up to 12 hours. The feelings can include feelings of confidence, euphoria, hallucinations, time dilation as well, so you kind of lose track of time. You don't know if time's going by slow or going by fast. Also ego dissolution, so you start losing conscious of where you are in space and time, and then you become a singular event within your so-called trip or high. Also increased heart rate, so with that heart rate, your temperature rises as well. It compromises both your prefrontal cortex and your visual cortex. So you essentially, because of its hallucinogenic behavior and the fact that it impairs cognitive behavior, obviously you don't want to drive or anything like that or be doing anything important because you are not in control at that point. You can either imagine things in front of you or imagine things that are not there, right? This drug also acts like a partial agonist for serotonin receptors, so it binds to serotonin receptors and acts as serotonin, so it floods the synapse with a bunch of serotonin. Your urinary system is also affected by the drug. It's one extreme or the other, so you either retain your urine, so you do not urinate at all, or you're on the other extreme and you can't stop urinating. Either way, both of them do lead to dehydration in the body, and because of the increased body temperature during the effects of the drug, you do run severe risk of kidney failure. Within this drug, there hasn't been any confirmed overdoses of any sort. Moving forward, also, it is metabolized by monoamine oxidase. It does have a half-life of about 2 hours in the average human being. Obviously, that is affected by several factors like age, gender, and weight. But a fun fact about this drug is that it was originally marketed, like I said, as a libido enhancer, and it was labeled Nexus, so it was prescribed by doctors